I can't tell you how many times a patient sits down in my office and right before we wrap up the visit, almost as an afterthought, they say, "Actually, doc, can I ask you something?" And it's often about the same thing, erections. Whether they can get one, whether they can keep it, or whether something is wrong with it. So let's have this conversation today because there's actually more going on here than most people realize. I'm Dr. Esther Shermadou. I'm a family medicine physician with a focus on metabolic health and helping men and women stay stronger, healthier, and more independent as they age. In this video, I'm going to walk you through what erectile dysfunction is, why it happens, why your doctor should care about more than just the symptom itself, and what your treatment options are, both the medications and the changes you can make on your own. Stay with me until the end because one of the most important things I'm going to tell you has nothing to do with sex, and it could literally change how you think about your overall health. So let's start with the definition. Erectile dysfunction, or ED, is when you're consistently having trouble getting an erection, keeping an erection, or both. And I say consistently because it's normal for every man to have an off night here or there. What I'm talking about is a pattern, something happening on a regular basis over weeks or months. Erectile dysfunction is one of the most common things I see in adult men at every age. It's not a reflection of who you are as a person, and it's not a character flaw. It's a physical process happening in your body, and in a lot of cases, it's generally fixable. So why does this happen? An erection is actually a fairly complex event. You need healthy blood vessels to carry blood flow into the penis. You need healthy nerves that are signaling correctly. You need enough of the right hormones, mainly testosterone, and you need your brain and your mood in a state that allows this process to happen. When any one of those symptoms is off, you can end up with ED. Now, let's talk about some of the main causes I see in practice. The number one cause of ED is vascular, or a problem with your blood vessels going into or leaving the penis. And this is the most common cause by far, especially in men over 40. If the small blood vessels feeding into the penis aren't functioning well, they can't deliver enough blood flow to create or maintain an erection. Number two, hormonal issues, mainly low testosterone levels. I've talked about causes of low testosterone and what you can do about it in another video, so make sure you go check that out. Another important cause of ED is problems with your nerves. Conditions like diabetes, which can affect nerves and blood vessels, is a big cause of erectile dysfunction today. Other nerve-related etiologies include certain spine and pelvic surgeries and some neurological conditions, which can interfere with the signal traveling from the brain to the penis. Number four, medications. A number of common prescriptions, including some blood pressure medications and some antidepressants, list erectile dysfunction as a known side effect. These medications are important to our overall health though, and stopping them completely without talking to your doctor can have significant side effects, including erectile dysfunction. So it's very important to talk to your doctor if you're concerned and do not just stop them on your own. And number five, psychological factors, stress, anxiety, depression, and relationship issues. This is real and it's especially common in younger men. Here's what I really want you to take from this section, and it's a big part of why I'm making this video. In a large number of men, especially men over 40 and 50, erectile dysfunction is not a standalone problem. It's often one of the first signs that something is happening in your blood vessels throughout your entire body. So that's what I want to spend on the next few minutes, because I think it's the single most important thing for you to understand, and that is the association between erectile dysfunction and cardiovascular disease. Erectile dysfunction can be a predisposing signal of cardiovascular disease. The blood vessels that supply the penis are smaller in diameter than the arteries that supply your heart. So when plaque is building up inside your arteries and narrowing them, it doesn't happen everywhere at the same time. It tends to show up in the smallest blood vessels first, because a given amount of plaque is going to narrow a small vessel much faster than it narrows a larger one. And because of this, the blood vessels in the penis are frequently affected before the blood vessels in the heart even start producing symptoms. So what does this mean in practice? It means that erectile dysfunction can show up 2 to 5 years before a man has any clinical signs of heart disease. 2 to 5 years. That's not a small window. That's an early warning sign that your body is giving you for free before anything more serious happens. So if you're dealing with erectile dysfunction and your first instinct is to just get a pill and move on, I understand that instinct. But this is a moment to get your blood pressure checked, get your cholesterol checked, get your blood sugar checked, and have a serious and honest conversation with your doctor about your cardiovascular risk. This is one of the few times that your body's actually giving you a warning sign. And that's good news because it means you have time to act on it and make some changes. This doesn't mean you can't simultaneously be treated with a pill to help with your symptoms as you make these lifestyle changes, but just don't take the pill-only approach. Okay, let's talk about treatment options, starting with the medications that you've probably heard of. Viagra and Cialis are the most common. Both of these belong to a class of medications called the PDE5 inhibitors, and these medications work to allow the blood vessels in the penis to stay relaxed longer, which allows for increased blood flow in and therefore a stronger erection. One often forgotten note on these medications, though, is that they don't create arousal out of nothing. You still need stimulation for them to work, and sometimes you can take multiple doses before they start working well. One important thing to remember, though, is that if you're taking nitrate medications, which are sometimes prescribed for chest pain or heart disease, you cannot combine them with these medications. That combination can cause a serious and dangerous drop in your blood pressure, so it's important to talk to your doctor before taking these medications. Now, medication is not the only path. For a lot of men, especially when erectile dysfunction is caused by vascular issues like high blood pressure, high cholesterol, tobacco use, lifestyle changes can make a real difference, sometimes on their own and sometimes alongside the medications. The first lifestyle change we'll talk about is movement. Movement is critical when it comes to improving our lifestyle. We live in a very sedentary world today, from our jobs to activities we choose to do to relax and relieve our stress. But you want to aim for around 150 minutes a week of moderate intensity aerobic activity, which is about 30 minutes 5 days a week. This isn't only about losing weight. Moderate intensity exercise, which means getting your heart rate up, not just leisurely walking, has been shown to have very near similar results in improving ED as medications like Cialis and Viagra. Number 2, weight. If you're carrying excess weight, losing even 5 to 10% of your body weight has been associated with real improvements in erectile dysfunction. And number 3, food. The Mediterranean diet is the most studied diet, and this pattern of eating involves vegetables, fruits, legumes, olive oil, fish, less red meat, and processed foods. And has consistently been linked to a lower risk of developing ED no matter what age you start. The earlier the better. And number 4, and perhaps one of the most important, sleep. Aim for about 7 hours or more of quality uninterrupted sleep. Sleep has a direct effect on your testosterone levels, and testosterone plays a real role in erectile dysfunction. Number 5, alcohol. Try to keep it under 7 drinks a week, and less is generally better. And finally, number 6, smoking and recreational drug use. This is one of the clearest, most direct things you can do. Stopping smoking specifically improves blood vessel function, and it does so fairly quickly. These lifestyle changes are nothing short of fancy, but they help with erectile dysfunction and overall health. As simple as they are, changing one's lifestyle can be difficult to do on your own, but choose one lifestyle change that seems the least difficult and improve on it in one simple way. Swap one fast food meal with a home-cooked one or whole food options. Get ready for bed an hour earlier. Drink one less alcoholic drink this week. These small changes will add up quickly over time. Now, what if pills and lifestyle alone aren't enough for you? I want to briefly mention that there are other medical options, including vacuum devices and injectable medications too. But I'm not going to delve into these into this video, but just know that if first-line options are not working for you, you are not out of options, and that's a conversation worth having directly with your doctor or a urologist. So let's bring this together. Erectile dysfunction is common, but it's not a character flaw, and it's often connected to your overall blood vessel health. It can show up years before other signs of heart disease, which actually makes it a useful information, not just a frustrating symptom. Medications like Viagra and Cialis work, but this is our chance to actually work on lifestyle changes to improve our overall health. Things like movement, weight, food, sleep, alcohol, and quitting smoking can meaningfully improve ED on their own or alongside treatment. So let's end on 2 prescriptions for the week. Number 1, make an appointment with your doctor and make sure to ask for your blood pressure to be checked, your cholesterol, and your blood sugar, alongside a direct conversation about your erectile function. Don't just treat the symptom. Use it as a reason to get your full health in check. And number 2, pick one lifestyle habit you can start to improve on this week and make one small positive change. Write it in the comments for accountability. Small, sustainable habits really do lead to huge changes over time. And if you live in Ohio and Indiana and are concerned about your erectile function and your metabolic health, book a consultation call today and let's talk. All right, that's it for now, and I'll see you in the next one.